Isoprenaline is a catecholamine non-selective beta-adrenergic agonist typically used to treat bradycardia and heart block. In this video, let's find. What is isoprenaline? What is isoprenaline used for? Contraindication. What are the side effects of taking isoprenaline? How does isoprenaline work? How to use isoprenaline? What is isoprenaline? Isoprenaline, or isoproterenol, is a medication used for the treatment of bradycardia, heart block, and rarely for asthma. It is a non-selective beta-adrenergic agonist that is the isopropylamine analog of epinephrine. Isoprenaline was granted FDA approval on February 19, 1948. What is isoprenaline used for? Isoprenaline is indicated to treat mild or transient episodes of heart block not requiring electric shock or pacemakers, serious episodes of heart block and Adams-Stokes attacks not caused by ventricular tachycardia or fibrillation, and bronchospasm during anesthesia. Isoprenaline is also indicated for cases of cardiac arrest until preferable treatments like electric shock and pacemakers are available. Isoprenaline is also indicated as an adjunct therapy to fluid and electrolyte replacement therapy in hypovolemic shock, septic shock, hypoperfusion, congestive heart failure, and cardiogenic shock. Contraindication. It should not be used in people with tachyarrhythmias, except in special circumstances, tachycardia, or heart block caused by digitalis poisoning, ventricular arrhythmias which require inotropic therapy, or with angina. Side effects. Adverse effects of isoprenaline include nervousness, headache, dizziness, nausea, visual blurring, tachycardia, palpitations, angina, Adams-Stokes attacks, pulmonary edema, hypertension, hypotension, ventricular arrhythmias, tachyarrhythmias, difficulty breathing, sweating, mild tremors, weakness, flushing, and pallor. Isoproterenol has been reported to cause insulin resistance leading to diabetic ketoacidosis. Pharmacodynamic. Isoprenaline is a non-selective beta-adrenergic receptor agonist used in a number of indications for the heart, as well as bronchospasm in anesthesia. Isoprenaline has a short duration of action as it is rapidly cleared, and a wide therapeutic index. Patients should be counseled regarding the risks of isoprenaline in the treatment of cardiogenic shock following myocardial infarction, paradoxical worsening of heart block, or precipitation of Adams-Stokes attacks. Mechanism of action. Isoprenaline is a non-selective beta-adrenergic receptor agonist. 2 Agonism of beta-1 and beta-2 adrenergic receptors causes the alpha subunit of G protein-coupled receptors to exchange GMP for GTP, activating them, and allowing the alpha subunit to dissociate from the beta-gamma subunits. Dissociation of the alpha subunit activates adenylate cyclase, converting ADP to cyclic AMP. Cyclic AMP activates protein kinase A, pKa, which phosphorylates cardiac L-type calcium channels such as Cav1.2. These channels depolarize cells by inward active transport of ions. Agonism of beta-1 adrenergic receptors lead to increased strength of contractility, conduction of nerve impulses, speed of relaxation, and rate in the heart. Agonism of beta-2 adrenergic receptors leads to glycogenolysis in the liver, glucagon release from the pancreas, and activation of the renin-angiotensin-aldosterone system. In the alveoli, agonism of beta-2 adrenergic receptors activates similar pathways to the heart, however the end result is regulation of sodium channels. The cystic fibrosis transmembrane conductance regulator, CFTR, and sodium-potassium ADPase. pKa phosphorylates scaffolding proteins and sodium channels, increasing the number of sodium channels on the apical side of alveolar cells and increasing active transport of sodium ions into cells. Agonism of beta-2 adrenergic receptors can also increase chloride ion transport across CFTR. These actions lead to passive transport of water out of the alveoli, and the clearance of alveolar fluid. Half-life. The half-life of intravenous isoprenaline is 2.5 to 5 minutes. Oral isoprenaline has a half-life of 40 minutes. Dose. Adams-Stokes attacks, cardiac arrest, or heart block. For bolus, 0.02 to 0.06 milligrams, 1 to 3 milliliters of a 1:50,000 dilution, initially, then doses of 0.01 to 0.2 milligrams. For infusion, 5 micrograms per minute, 1.25 milliliters of a 1:250,000 dilution, initially, then doses of 2 to 20 mcg/min based on patient's response. Shock. 0.5 to 5 mcg/min, 0.25 to 2.5 milliliters of a 1:250,000 dilution, for infusion. Bronchospasm during anesthesia. 0.01 to 0.02 milligrams for repeat PRN. Safety advice. Isoprenaline falls into category C. In animal studies, pregnant animals were given this medication and had some babies born with problems. That's all the information about isoprenaline we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.